Hi everyone, we are nursing students from Arizona State University and we will be doing a video demonstration on how to properly use MDI and DPI inhalers as well as how to incorporate a spacer. In this simulation, we will have a patient named Whitney Weezy. Whitney Weezy is a 65-year-old female with a history of asthma. Whitney was in to have a checkup with her primary care physician and reported using her rescue inhaler 3 to 4 times per week. Her doctor prescribed her an Advair inhaler for better long-term management of her asthma. We will also be doing more education on how to properly use her albuterol inhaler.
Hi, my name is Lindsay. I'm going to be your nurse today. Can you verify your name and date of birth for me?
Whitney Weezy, 6/28/75.
Okay, great. So I'm going to be going over some medications with you. One is a new medication, Advair, that you're going to be getting, and another medication is one that you're already taking, both of which your doctor had prescribed. Before I go over your new medication, I do want to see how you use your albuterol first. Would you mind doing a demonstration for me?
Okay. So I do have to admit, sometimes I do struggle. I feel like I do struggle a little bit with the timing
Okay.
of it. It's just not as easy as it used to be, but I'll show you.
Okay. Okay, so one thing that can help you with your medication and how you take it is it's called a spacer. This makes it easier for you to load the medication into the spacer and then for you to inhale it on your own time. That way you don't have to use the same coordination as you used to be able to do. So I'll show you how to do it and then I'll have you demonstrate that to me.
Okay. Oh, that's a little intimidating.
So it's super easy. So you have this spout here, and you'll connect your inhaler to it. You will press the button just like you normally would. That medication is going to go into this area here, and then when you're ready, you'll exhale, and then inhale your medication on your own time, so you don't have to coordinate it. Okay.
Oh, okay.
And then you'll hold it for 10 seconds, and then exhale slowly. Okay, do you want to try it?
Sure.
Okay.
And is it like, I always feel like I need to like breathe in really fast. Do I have to do it with this too? Or?
For this one, you can breathe it in. You don't have to do it super quick, but you can breathe it in at a normal pace.
Okay.
Good.
Okay.
That was really good. So I think that'll help you with this medication, make it more effective when you use it. Okay, that one is your rescue inhaler, and that's for short time when you do feel like you need a relief instantly. Okay. Do you have any other questions about that one? Okay. So next we'll go on to your new prescription, Advair. This disc is called DPI, a dry powder inhaler. It is really simple to use. It kind of looks complicated at first, so just let me know if you have any questions, okay?
Okay.
So first of all, this little area here, it has a 0 on it now. This is just a demonstration DPI, so you can use it, but there's no medication in here. This little 0 here counts down how many doses are left. So when you have about 10 left, I would say that's time to get a new prescription. Okay. You'll click this over and you'll open up the device. You have your nozzle here, and then your like a little lever here. To get the medication ready, you'll click down on the lever. When you do click down on the lever, you don't want to exhale into this nozzle, or you don't want to tip it downwards. You do not need to shake this like you need to shake your rescue inhaler. And then as soon as you click down on the lever, the medication is ready for you. Okay, so you don't need to worry about the hand-breath coordination. The same steps do apply. You'll exhale, but with this one, you do need to inhale deeply and rapidly. So you'll put your lips on here, and then inhale deeply and rapidly, hold your breath for 10 seconds, and then exhale slowly. Some people do say that they can feel the medication entering like into their mouth, and they might be able to taste a little bit, but that's completely normal. Okay, before.
Does it taste gross?
I don't think it has like a great taste to it, but it shouldn't be too obnoxious. Okay. Do you have any other questions before you demonstrate this for me?
Are there any like side effects? Like, is it gonna make me super thirsty if I'm gonna be breathing in like powder or like?
So one thing that you do want to do afterwards is rinse out your mouth. This medication is a steroid, so one of the side effects is like mouth fungal infections.
Oh.
So you do want to rinse out your mouth when you're done, and those will help prevent those infections.
Oh, okay.
Okay, so that's a really good question. Do you want to demonstrate that for me?
Sure. Let's see if I can remember.
Perfect. Just remember to not tilt it too much or exhale into it. Okay, good. Just next time maybe exhale a little bit slower.
Okay.
But other than that, you did a really good job.
Okay. So why would I have to have two different inhalers then?
So it's a really good question. One is your rescue inhaler you'll use when you're symptomatic, meaning you're short of breath, you're wheezing.
Oh yeah, you did say that.
Yeah,
Okay.
so you'll use that, and then this one you're going to use your Advair, your DPI. You're going to use twice a day. Those have more long-term effects, so that'll help prevent you from getting symptomatic.
Oh.
Okay, so it is important that you, even though you're not feeling short of breath, you're not wheezing, that you do still take this medication as prescribed.
Oh, okay.
Okay? What other questions do you have?
Do you happen to have anything that I can take home with me that would help
Yeah.
remind me of how to?
So I have this pamphlet for you, and this goes over step by step exactly what to do.
Oh, awesome.
Yep, so that way when you go home, you can be reminded of what to do.
Awesome.
Okay.
All right. Well, thank you, Lindsay. I really appreciate it.
Okay, thank you.